So, Gavan, will you take us through the HSE's contributions?
Well, this has been the very first thing that anyone in Leinster House has done in front of a parliamentary chamber so far this year, Colette. That it is, of course, a story that we often find ourselves dealing with every January, and that was a running theme from the contributions from TDs and senators to the HSE's interim chief executive, Stephen Mulvaney, and other senior officials who were attending the Oireachtas Health Committee this lunchtime. The general thrust of their questions: why was all of this so foreseeable and yet so unavoidable? And the HSE have effectively said that they're operating far beyond the worst case scenario. Even the most pessimistic modelling for respiratory viruses for the winter period that we're still going through did not anticipate that there'd be so many people in need of such urgent critical care. He said that at one point over winter there were 9 days where there were over 2,000 calls for ambulances, which is certainly a brand new record as far as they are concerned. And this is what he said when it was put to him by Fine Gael Senator Martin Conway, that the HSE's winter plan had been what he called an unmitigated disaster.
I wouldn't accept at all, Deputy, that it's been an unmitigated disaster, but will we review all of what we learned on the way up to the most recent crisis and during it? Yes, we will, because we do need to see what can be improved. We need to see, Deputy, what has made the most impact, because there has been substantial impacts in terms of trolleys numbers going substantially down. Now, to be clear, Deputy, they're at a level, one trolley is too many, so we don't believe any level of trolleys is acceptable. Given the levels they had reached and the levels they could have got to, we think the overall system response, and I would include managers in that, frontline, middle managers, the whole system responded, general practitioners, all across it, inside and outside the HSE.
So have you heard there Stephen Mulvaney basically saying that the number of trolleys still has come down, and although any person being treated on a trolley is unacceptable, that the numbers have come down quite a bit in the last couple of weeks. Politicians there of course asked why that was the case, and he says that it's because of the special procedures that have been put in the last couple of weeks, which he says are not sustainable all year round. People may wonder why, for example, it wasn't the case that GPs might be asked to work extra hours, or that hospital consultants might be asked to show more flexibility in their rounds. Stephen Mulvaney says that it simply wouldn't be sustainable all year round to do that they are really only things that can be sustained for a couple of weeks at a time, but you simply could not build the whole healthcare system around that. But of course, when it comes to the human cost of all of this, again, questions for the HSE as to whether they could vouch with certainty that nobody had died and pay the ultimate price as a result of the overcrowding this hospital winter. He says that he simply cannot guarantee that that is the case.
All right.